Hello, my name is Sloan Adams, and I did my project on celiac disease. Celiac disease is a chronic autoimmune disease that damages the small intestines from the consumption of gluten. It targets the villi of the mucosal layer, and over time, the damage can cause digestive problems, and it can further damage other parts of the digestive tract as well. When gluten is ingested, the body detects its own cells as foreign, and then this in turn causes damage to the villi of the small intestines. And the villi are used to absorb nutrients when things are digested. So if these villi are damaged, then they cannot absorb the right nutrients that the body needs, and then become malnourished, dehydrated, anything like that. So the difference between a gluten intolerance and celiac disease is celiac disease causes damage to the small intestines, whereas gluten intolerance, you can have all the same symptoms that you have with celiac disease, but the small intestine is not damaged over time. You just experience these symptoms with no damage. Okay. So because of celiac disease typically occurs with certain genes, and these genes are triggered when food that contains gluten is ingested. Celiac disease almost always happens with people who have DQ2 and DQ8 gene variants. People who do not have these variants typically are unlikely to develop celiac disease. So when you are consuming gluten such as wheat, barley, rye, and some oats, they can trigger this abnormal immune response, and this can cause bloating, nausea, vomiting, diarrhea, malnutrition, all those things. So in this picture, it just shows some food that contains gluten, and that would be bread, pasta, crackers, cereal, beer, and also some medications as well. So patients with celiac disease need to be very cautious of what medications they're ingesting, and to make sure that none of their medications have gluten in them. So celiac disease is known as a human leukocyte antigen disorder, and so these proteins are found on most cells, and they are very important to help distinguish self cells versus foreign cells, and they're also important in immune responses in the immune system. So if they are damaged or something happens, then they're unable to distinguish us versus foreign things, so they could destroy us. So a very common thing in celiac disease is having lesions on the intestinal mucosa, and this is very common with the disease. There will be blunting of the villi structures, with also hyperplasia of the crypts, so just elongating them, and they're smashing together. And these lesions are very common with celiac disease patients. So, epidemiology, celiac disease is recognized worldwide, and it is mainly in Northern and Western Europe, and it affects about 1% of the population. Observation shows that across all regions, celiac disease is increasing over time. Many patients are either undiagnosed, misdiagnosed, or they're asymptomatic altogether and have no idea that they have celiac disease. So those numbers are not included in the epidemiology studies that are shown. But celiac disease can happen at any age, but it is most likely to develop before the age of 10, and then you will have it for the rest of your life. But it can also affect geriatric ages as well. This in turn could be due to a gluten intolerance over time, and your body just not being able to handle the gluten like it did when you were younger. In the United States, celiac disease is more prevalent in white Caucasian individuals than African American or Hispanic individuals, and it also is more prevalent in females more than males. So here is a picture of a normal mucosal layer of, these are the villi of the small intestine, and then right here, this is a normal side by side to an abnormal villi. So in the normal intestinal mucosa, they have normal villi. As you can see, they're all pretty uniform in their crypts. They all have glandular crypts, and those are all pretty uniform as well. And they also have a normal number of intraepithelial lymphocytes, or T lymphocytes, and that will be about 25 lymphocytes per 100 epithelial cells. And then in this abnormal one right here, this is a patient with celiac disease. You can have an increased number of those intraepithelial lymphocytes, those T lymphocytes, and a higher number of enterocytes as well. There will also be a villus atrophy, like a flattening of the villa with that crypt hyperplasia. So in a case study, there was a 22-month-old little boy that was admitted to the emergency department, and this little boy over 6 months showed signs of vomiting after meals, watery diarrhea with appetite loss. This child was not shown to be running any fevers in these 6 months, but the parents did notice a significant amount of weight loss in those 6 months. Once doing the clinical medical history, it was shown that the child had no clinical medical history, and the family medical history was normal as well. The patient was also up to date on all of his mandatory vaccines. So the child was then taken for a physical exam, and the child showed moderate signs of dehydration with a dysphoric appearance. And he also had some abnormal bloating. When they did the abdomen palpitations, there was no signs of any pain or discomfort on the child. So then the patient was then admitted into the pediatric department and was given a full series of laboratory tests that included full blood tests with leukocyte tests, red blood cell tests, with also electrolyte counts, inflammatory markers, and antibody tests. They also collected a stool sample from the child, and fecal cultures were done. And all of the blood counts and blood tests came back negative or in abnormal range. They did an abdominal ultrasound, and that came back negative, normal as well. And then all of his vitals were normal as well, all within range. They ended up doing a celiac serological test, and that was done. And so what the serological test does is that's going to check for the tissue transglutaminase, and it is that's testing for an IgA antibody test. And so when the test results came back, it showed that he had a high level of the IgA TG2, and those levels were above the normal level. So another test was performed just to double check. When that second test was done, it indicated that the patient still had those same levels, and then the patient was later diagnosed with celiac disease. The patient was later discharged after hydration and nutrients had improved, and then later, a month later, went to his normal physician and was checked after that. So for a prognosis and a treatment, it's very common in patients to have dehydration, malnutrition, and diarrhea. An early diagnosis for the disease can help with the treatment and the overall status of the patient. And so right here, this is just showing those serological tests that were done, and then they can also do a small bowel biopsy to go in and with an endoscopy just to check and make sure that that the serological testing was correct. So with these tests, the rapid test, it's used to determine if a patient or child has celiac disease. And there's also HLA genetic typing and biopsies of the intestines with patients. And the main treatment for patients with celiac disease is just sticking to a completely gluten-free diet. There are currently no treatments besides the diet out there right now, but doctors and researchers are still trying to figure out any treatments besides just sticking to that gluten-free diet. So some signs and symptoms, they can also vary from patient to patient. Some can be asymptomatic, some can be symptomatic. It just depends. But the most common digestive signs are the chronic diarrhea, bloating, nausea, vomiting, malnutrition, dehydration. In children who do have celiac disease, they can experience growth and development delays. So this can be delayed puberty, it can be damage to the teeth enamel, or like when the adult teeth come. It can also have mood swings and weight loss and slow growth and development. Symptoms that affect other body parts are fatigue, bone and joint pain, and some nervous system problems. So when biopsies are done, duodenal biopsies are common practice that is used to determine the damage that is done with celiac disease. They will also do an endoscopy just to check and make sure and to examine the folds of the intestines. And then the intestinal biopsy will be taken to later confirm the diagnosis. Biopsies are typically done while a patient is on a gluten diet and when they are not on a gluten diet, and they take both of those results and they determine the differences, and they will compare those results. So right here, this is a duodenum endoscopy, and that is a patient with celiac disease. And biopsies are known to correctly diagnose a child with celiac disease 95% of the time. Okay, so in conclusion, celiac disease is an autoimmune disease, and it is just damaging the small intestines by eating gluten, and treatment is still being developed, but most importantly, just sticking to a gluten-free diet and staying away from all the breads and the pastas and the cereals and all that will help patients with celiac disease. And it is still being currently studied today, and the numbers are currently increasing of people who are having celiac disease. And then here is my works cited. And thank you so much for watching my presentation. Thank you.